channel. Today inshallah we will talk about hypertension. Before we talk about hypertension, we must talk about non-communicable disease. Non-communicable disease refer to body conditions that are not caused by an acute infection but require prolonged care and treatment and long-term health consequences. They are also known as a chronic disease. And as mentioned above, these tend to have a long duration. This disease results from combination from environmental, behavioral, genetic, and physiological factors. The main types of non-communicable disease are a cardiovascular disease, diabetes disease, chronic respiratory disease, and also high blood pressure and cancer and heart attack or stroke. Yes, definition: the hypertension or high blood pressure. It is a common condition that affects the body arteries. It is also called hypertension. If you have high blood pressure, the force of blood pushing against the artery wall is consistently too high. The heart has to work harder to pump the blood. Blood pressure is measured by millimeters of mercury, mm, and G. In general, hypertension is a blood pressure reading of 130/100 above 80 mm at G or higher. The American College of Cardiology and American Heart Association divide blood pressure into four general categories. Number 1, normal blood pressure. It is between 120 and 80 mmHg or lower, but the top number ranges from 120 to 192, and the bottom number is below, not above the 80 mmHg. Stage 1 hypertension top number ranged from 130 to 193, and the bottom number between 80 and 89. And the stage 2 hypertension, the top number is 140 or higher, and the bottom is higher than 90 mmHg. Yes, now we will talk about when to measure blood pressure. Measuring blood pressure is only the way to diagnose the hypertension, as most people with raised blood pressure have no symptoms. So, the hypertension is no symptoms. Blood pressure measures should be conducted on adults during routine visit to primary health care facilities. A blood pressure measurement is particularly important in adults who have a prior heart attack or stroke, or have a history of heart attack or block, have a diabetes or obese. How to measure blood pressure? As we nurse, we know how to measure blood pressure, but there are some steps. You must ask the patient if he smoke, if he have pain or have any emotion distress, if he drink any caffeine. The blood pressure mustn't record because it is false. Before 5 minutes from measuring blood pressure, get in position. Sit back, sit quietly, and feet must be on the floor. Rest the arm at the heart level and use the same arm when we are recording the blood pressure many times. Take the test. We will put the cuff of the cuff on the above the elbow, above 3 centimeters from elbow, and must 2 fingers throw from the cuff and start recording the blood pressure and share the result. Classification of blood pressure: optimum blood pressure, there is normal, pre-hypertension, grade 1 hypertension, grade 2 hypertension, and grade 3 hypertension, and this is the ranges of everyone. Now we will talk about management of hypertension. Decisions about the management of patients with hypertension shouldn't be based on the level of pH, blood pressure alone, but also on the presence of other risk factors, target organ damage, and contaminated disease, as well as other aspects of patient personal, medical, and social condition. Initial of drug treatment, unless contracted of for use of ACE inhibitor as first line as a treatment, start with a small dose of diuretic, 12 and half milligram hydrocortisone, maximum daily dose of 25 milligram. Use low dosage and treat upward at schedule depend on patient age, needs, and response. If no response, try a drug for another class or add a second agent from a different class. For patients with multiple risk factor associated clinical conditions and or target organ damage, drug treatment should be initiated within a few days after confirmation of diagnosis of hypertension. For patients with stage 1 and stage 2 of hypertension without ACC or TOD, the initiation of a drug therapy should be made after failure of lifestyle modification, except in cases of hypertension during pregnancy. Continue with lifestyle modification for 6 to 8 weeks before considering a drug treatment. For patients with stage 1 hypertension without cardiovascular disease, ACC or TOD, continue with lifestyle modification for 3 to 6 months before considering a drug treatment. We will talk in the next video about hypertension in pregnancy. I wish you are take useful information from me, and thank you.